Good evening to the Makah community. Today is Friday, September 17th, 2021. This is the Makah Tribe's COVID-19 Pandemic Response Update. My name is TJ Green, Chairman for the Makah Tribe. This message is brought to you on behalf of the entire Makah Tribal Council, Vice Chairman Patrick DePoe, Treasurer George Chad Beauchamp, Councilman Keith Johnson Sr., and Councilman Nate Tyler. Today, after careful deliberation with our public health officials and our medical staff and our emergency operations commander and the whole EOC group, we have made changes to the shelter-in-place order. And this will be effective at 8 a.m. tomorrow. That will be effective 8 a.m. Saturday, September 18th. We will be moving out of shelter-in-place and into a phase 2 within our public health order. So we're going to go through some of this real quick to make sure that we understand the health order. Here's resolution 98-21 that approves health order 07-21. And so once again, the council met today and met with our public health officials and our some of our lead staff on our emergency operations team to change the public health order effective at 8 a.m. tomorrow, Saturday, the 18th of September. So this is the order that has been approved by the Tribal Council. Some of the normal background of the numbers been updated regarding the pandemic and what's going on throughout the country and the state of Washington. So, here's the, the main part of the order that moves us to phase 2. This is Makah COVID-19 Public Health Protocols phase 2. All individuals on the Makah Indian Reservation must follow the Makah COVID-19 Public Health Protocols phase 2. So that means outdoor gatherings are limited to 10 people, except for the assembly for the purpose of cultural and religious practice with an approved safety plan. Indoor gatherings are prohibited except for the assembly for the purpose of cultural and religious practice with an approved safety plan at 25% building capacity. We want to let people know that gatherings are still there's still risks involved in gatherings. So make sure that we're practicing safe social distancing at those. If you attend any of those types of events, proper mask wearing to be done at all of those activities is highly recommended. And then household groups are reinstated in accordance with the Makah COVID-19 public health protocols, with the exception that household units not located on the Makah Indian Reservation may not be considered a part of a household group. Residents of Neah Bay and traveling protocols, these remain as they've been throughout much of the last several health orders. We must follow the traveling protocols under COVID-19 public health protocols. If you've been in close contact with people outside of Neah Bay, you must enter a preventative quarantine. And this is an area that we've struggled with. So we really want to emphasize that people do that and be honest with those activities. It's very important that if you've had any close contacts outside of Neah Bay and outside of your household group, that could be a risk, that you do a preventative quarantine for at least 14 days. While you're in a preventative quarantine, going to work is allowable, but safety protocols must be followed, certainly in your workplace, and avoiding close contact with others. Certainly testing is highly recommended if you believe that you've been put at risk during any of your travels. Certainly travels through airports and being on airplanes and other forms of public transportation where you're in close proximity to others are considered a high-risk type activity. Visitors to the Makah Indian Reservation, enrolled Makahs and their household members traveling with them are allowed to visit the Makah Indian Reservation for the duration of this order. That hasn't changed. Business visitors must still complete a business visitor attestation form online and non-Makah personal visitors are not allowed for the duration of this health order. And then the rest of it covers enforcement, could be fined up to $500 for not following the health order. And that's about it in there. So once again, effective at 8 a.m. Saturday, September 18th, we are moving to phase 2 in our public health order. So we do want to emphasize a few things that council considered in this decision. We realized that recently there were a number of cases that occurred yesterday, and we carefully analyzed these cases with our public health officials. 5 of the cases were in the same household, and people were already in quarantine. So, we took a look at that and looked at the risk of that poses to the community with those people already in quarantine and already in the same household. There were not, those were expected cases because of the nature of the isolation and quarantine. We knew that those cases were coming down the pipe because there were infected people within the household, and they chose to remain together. Once again, we do not force families to split up when we put them in isolation and quarantine. We do offer options if they're willing to do that. We do have the cabins available for those situations, but if families choose not to, we're not forcing them to separate. The other thing that we want to talk about that we considered is people's mental health. It's very important. We've been in this pandemic a very long time, and it's been very agonizing for a lot of us. And being separated from our families and going back and forth between the different phases, it is very trying. It's been over a year and a half, and so the council is very concerned about the mental health within the community, people's activity, and people becoming too secluded in this process. So we're looking at things that we can do and how we can do them safely. One of the biggest things that we do need to practice at all times when we're out in public is definitely wearing these masks. And we put these on whenever we're out in public, whenever we go around people that are not a part of our household group, definitely when we travel off the reservation and have to go shopping and do other activities. We want to be wearing that mask, and once again, doing that preventive quarantine if you feel you're exposed off the reservation is very, very important. We want to talk about returning to school. School will return on Monday. The school district has been working diligently to provide a safe learning environment for the children. It's very important that we educate our children and that they have that opportunity to go to school and to be with their peers, and that is the best learning environment for them. So the tribe and the school district been working together to get the best plan we can for that for our students. It will be monitored very closely. There are things going on across the country that we know some of you are paying attention to and looking at, and we're looking at those things too, and looking at that data and our school, and working with the Department of Health, with the county public health officer and the Makah Tribe's public health officer, and input from our own EOC have developed some very good plans to help monitor virus activity should it occur within the school, to contain it and report it and get people taken care of and make sure that our kids are taken care of in that process. The council has considered that information and has agreed that school is something that we need to have taken place for our kids here. They've been in and out of the learning environment, and the best learning environment for them is being in person. But it is something that we are working very closely with the school district on, And we have a great deal of confidence in the plan that's been put together, and the procedures and all the additional training that they're doing for their staff, and things they're putting in place around testing to keep our community and our children safe for that learning environment. Also, the tribe is returning to work on Monday. People are expected to return to their offices and follow the safety plan. Once again, masks need to be worn in the workplace if you're not behind closed doors. If you go into any common area where other people may be present, certainly follow that workplace safety plan. And in those common areas where someone else is using a copier machine or those sort of items, make sure we're not crowding those areas. We do have or we have had cases that have occurred in the workplace, and we want to avoid those in the future. It's a priority of the council to provide a safe workplace for both the people that need to come obtain services from the Makah tribe, and for the people that are providing those services, for the employees. So let me check my notes here to see if there's anything else here. I think that about covers it. We're moving into phase 2 as of 8 a.m. tomorrow. Everyone, please be safe, be extra vigilant. It's always safest to stay at home and not do any unnecessary travel. If you do have to travel, follow all the safety protocols. The rest of the state and the county are still very high in the virus activity in areas all over the county and the state. However, the shelter in place has had its intended effect for our local community, and the trajectory that we're on when we went into shelter in place could possibly have led us to over 200 cases within the month's time. However, the shelter in place has definitely slowed that. We're on a trajectory right now to have around maybe 46 cases, and we can do better than that if we all practice these safety protocols from here on out throughout the rest of not just this month, but ongoing. This virus is, the Delta mutation of the COVID-19 virus that seems to be going through our community and the rest of the state and the country is highly contagious, and has emergency rooms and ICU beds taking up, not just in our region, but all over the state. So we want to keep that in mind and be mindful of that healthcare will be delayed for emergency or urgent circumstances. And so we want to be careful and mindful of other activities that we do and do them as safely as possible. Right to now, and looking at all of that data, we really need to understand that a lot of these people that are taking up those ICU beds in the hospitals and filling up the space that is putting a strain on healthcare across this country are unvaccinated individuals. So we want to encourage people to be vaccinated. We realize that there's a big divide amongst people regarding the vaccination, and people, do have their reasons, but we really want people to think deeply about that and really think about those things that are most important. Work to open up your mind to the information that's out there, and we are definitely making a plea for people that are not vaccinated to please get vaccinated. Our own data is showing that the large number of cases that we are getting now are unvaccinated individuals, and that's what's going on all over the country. And once again, it's unvaccinated individuals that are filling up most of those hospital beds. Not all of them. There's always exceptions to everything, right? This is not an absolute rule, but the data shows that a majority, by large, is unvaccinated individuals that are causing the strain within the healthcare system that we currently have. So take a look at that. Really think about what your reasons are for not being vaccinated. And we know there are people that have some really strong beliefs about that, and we want to respect that. But we want to let people know that it is highly encouraged by the Makah Tribal Council. So we want to thank everyone for their time. We thank everyone for being vigilant with the response to this pandemic. This is gonna be with us for some time, it looks like, and so we're gonna work on how we can continue to live our lives safely and take care of people's mental health and address all the issues that we face as a community, not just COVID. The council has been looking at that and working on those things. COVID has certainly been a huge priority, but we're looking at all the impacts that this is having on our community. So as a result of that discussion and the need for people's own mental health and wanting our children to be educated in the best manner possible, we feel comfortable at this time moving to phase 2 within our public health order. So everyone take care. God bless. Have a great weekend. Sure.